Thank you for the warm welcome. And I'm just going to get on with our show because we're short on time. Oops, I'm going backwards. This is what I'm going to do this morning. We'll go briefly over the policy context in the United States for drug driving. And then I will focus most of my time today on what we know about drug driving in the United States, looking at the National Roadside Survey very briefly, because later on we will have the real expert on roadside surveys talk about it. And I'll go over some of the self-reported measures of drug driving from household surveys and from school surveys. And then we'll look at some analysis of the census of fatal crashes in the United States, that what we can get out of it on drug driving. It was originally designed for drunk driving. And any other data sources that we could bring to bear in terms of informing this issue. There's a lot that we still need to know, and then I'm going to reserve for tomorrow afternoon's discussion the material on what it is that we're doing in terms of policy. So the policy context revolves around, in this most recent, the Obama administration has brought forward the goal of reducing drug driving in the United States by 10% from 2007, for which we have a measure, to 2015. It's a big lift, and we don't know yet what that is going to look like. But the big goal is to make preventing drug driving a national priority on par with preventing drunk driving. To work towards this goal, the National Drug Control Strategy calls for encouraging states to adopt per se drug impairment laws. It calls for collecting additional data on drug driving, of which we have a very limited amount at this point. It calls for enhancing awareness of drug driving by educating communities and professionals. And I think this is the very big start where some of the initiatives are coming in. It calls for providing increased training to law enforcement on identifying drug drivers, and most difficult of all, developing standard screening methodologies for drug testing labs to use in detecting the presence of drugs. So let me turn to, what we know about drug driving. In 2007, we had the Department of Transportation's National Highway Traffic Safety Administration implemented a survey, which it had done previously 3 other times on alcohol, a roadside survey. And this time in 2007, for the first time, they included drug testing for a number of different substances, illicit drugs, as well as medications. And in that, the survey found that 1 in 6 weekend nighttime drivers tested positive for an illicit drug or medication that has potential to impair driving. If we looked only at illicit drugs, it would be about 1 in 8 testing positive. There is a new cycle of data collection that just recently concluded. We don't have the results yet. John Lacey will be talking about more aspects of this survey later on. From this same survey, the specific substances that people tested positive for are, as you see here, 6.8% for marijuana, the most common after alcohol, stimulants, narcotic analgesics, sedatives, antidepressants, other drugs, and combinations of more than one drug class. If you focus on that first column, that 6.9%, we will now look at that 6.9%, which is the very last bar overall, and you'll see some variation in terms of age for marijuana, where the youngest age group, 16 to 20-year-olds, have the highest percentage testing positive. That's 12%, almost or more than twice that for the 35 to 44-year-olds. There's virtually none of the 65-year-old drivers testing positive for marijuana. That just gives you a flavor of what we know from the 2007 survey. I'm going to shift now to other sources of what we know about drug driving. This is an item from the National Survey on Drug Use and Health, which is an annual survey, household-based in the United States. And there is a question on self-report of whether that individual responding to the survey had driven under the influence of an illicit drug in the past year. This is their own interpretation of what driving under the influence would be. And as you can see from the time this survey was redesigned in 2002 to 2013, the most recent available, there has been a slight decline, a 1 percentage point decline from 5% over a decade ago to now. And that's, we hope that continues, but we don't know what's going to happen. This overall 4% of the population 16 and older who reported driving under the influence of drugs actually conceals a lot of variability. And I'm just going to bring up 3 different ways of cutting it up here. In terms of gender, you will see that males are more than twice as likely as females to report driving under the influence. And the young people, those aged 16 to 25, are 3 times more likely, more than 3 times more likely than those aged 25 or older to report drug driving. And in the US, race ethnicity is a big demographic variable, and you will see here the variation between white non-Hispanics, black non-Hispanics, American Indians, Native Hawaiians and Pacific Islanders, Asians, persons with reporting two or more races, and Hispanics being very different. If you look at the Asian percentage, it's 1.1% reporting drug driving, and those who identify themselves as having more than one race, 8.9% of them report drug driving. We shift now to another data source that is a school survey. It's a national survey that's been going on since 1975. They first started asking questions on driving after smoking marijuana or drinking alcohol in 2002. And these are asked of high school seniors. These are about 17 or 18-year-old kids in school. The question was, during the last 2 weeks, have you driven a car, truck, or motorcycle after drinking alcohol? And that is the trend line for 2001 to 2013. It's fairly flat. It has come down slightly. But when you look at, this is the alcohol trend, it's been coming down slightly. But for marijuana, it hasn't changed much. And in fact, in 2007, the percentage that report smoking marijuana and then driving has exceeded the percentage that reports drinking alcohol and then driving. From Texas, a very similar situation, thanks to Jane Maxwell here. They have very similar data on high school seniors as well. These are those who report driving while drunk, and these are those who report driving while high on drugs. And again, you will see that in the most recent year, 2012, in this case, drugs have now exceeded driving drunk. How much time do I have? I have 5 minutes. Okay, I'm going to go quickly through some analysis of a data system that the federal government compiles from states, which is a census of all traffic crashes that resulted in a fatality within 30 days of the crash. This is known as the Fatality Analysis Reporting System. There are some issues with this data set because states vary a lot in terms of what they test for, whether they test, the extent to which they report the findings, and so on. But this is one of the few data sources we have available to mine, so even with all its limitations, I think there's some information to be gleaned from here. From this slide, you'll see that from 2005 to 2012, the actual number of fatally injured drivers has been declining. This is consistent with motor vehicle crash deaths in general in the United States for many reasons, part of it having to do with better technology, airbags, things like that. But what I wanted to show here is the proportion overall that were tested for drugs in this database. And I'm only focusing on drivers here. You'll see that back in 2005, about half of the dead drivers were tested for drugs. And then later on in 2012, even if there were fewer dead drivers overall, the percentage being tested has gone up to about 60%. So that's an improvement. But let's just look at 2012 numbers, and those are probably too small for you to see. There were a little over 30,000 fatal crashes in the United States in 2012. And a fatal crash can involve 1, 2, or more cars. So these involved a total of 45,000 drivers. They did not all die. 21% died. Of the 21%, or 21,000, 13,000 were tested for drugs. And of those that were tested, 11 or almost 12,000, the results were known for the drug test. And out of that, 4,500 tested positive for a drug. So what we're looking at here is 38%, that red area comprises 38% of those people for whom the drug test results are known. But if you take these same 4,500 people and use the denominator of all fatally injured drivers, you have 21% of all the dead drivers testing positive for drugs. This is a conservative number, but it's a number that we can work from and try to refine as we go along. One of the issues with this data source is, as I alluded to earlier, the variability in reporting by state. There has been some improvement over the years, but as you can see here, this is a comparison of 2005 and 2012 with the same cutoffs. You can't see the legend, but the lightest color are those states for whom only less than 50% of their drivers were tested. And you can see that the middle of the country, there are a lot of states there that were testing fewer than 50% of their drivers in 2005. Some of them have increased that in 2012. But you would still see a state, for example, Maine, on the very top right, that has not budged in terms of their testing their drivers. So there are some issues with that. Excluding those who tested fewer than 50% of their drivers and a number of outliers, this is the overall picture of the remaining states relative to the national driver drug testing positive rate, which is that 38% in the middle in green. Now, this is I have 1 minute, so let me go through this most interesting of the slides. If you took all the fatally injured drivers, Almost 1/3 of them also involved alcohol, and almost half of them did not use seat belts. 10% failed to obey traffic signs. Speeding was a factor in 31%. 53% were single vehicle crashes, and 47% happened at nighttime. If you took only the drivers testing positive for any drug on each of these attributes, and especially in failure to obey traffic signs, you will see that those drivers that tested positive are more than 5 times as likely to have not obeyed traffic signs. So a final data slide here. These are the trends in terms of detection of specific drugs in these dead drivers. These are probably generally considered to be low estimates, even though cannabinoids are high, the highest of this group. There are some states that do not test for cannabinoids, so that's a low estimate. And finally, we're looking to other sources of data to see what we can mine out of them. Some of it is treatment admissions data for substance abuse. Many of the treatment admissions are referred to treatment by DUI courts. We cannot tell at this point whether it's alcohol or drug, but that is a segment of the population that should be of interest, for further interest for analysis. And what else do we need to know? Impairment thresholds, drug-specific particulars, as already has been noted earlier, the different drugs, including prescription medications, all have their own separate issues. And for the United States, there's a lot of subpopulation variability that we need to pay attention to, not to mention regional variability and state regulations as well. That's all I have.